All right. Can everyone see okay? No one's going to fall asleep with the lights off. Okay. Can you hear me?
Yes.
Okay. No one's going to fall asleep.
Not guaranteeing anything.
Not guaranteeing anything. Okay. So some of you may know me already, but my name is Morgan. I'm the program manager with Beata. I am a physical therapist, so you are all welcome to pick my brain about this topic. I am going to explain the difference between physical therapy and occupational therapy, how it can help you as your bodies are getting older, and also a little bit about how it's a little different from personal training and how we can work together with personal trainers as well. Okay. At the end, we'll have a little Q&A, which we'll have some microphones passed around. If at any point that you can't hear me clearly, or if you feel like I'm breathing too heavily into the microphone because I'm in my third trimester over here, please just raise your hand and I'll repeat myself, okay? All right. So the title of the lecture is Physical Therapy and Occupational Therapy for Aging Bodies, how to stay strong, mobile, and independent after 65. Okay? 65.
We passed that ship along.
I felt like it was a good starting point. I was trying to be neutral here. So like I said, I'm a PT, so I'm starting with physical therapy here. What is physical therapy? So show of hands, how many people have worked with physical therapy before? Okay, I love that. I love to see that. How many of you have worked with physical therapy in an outpatient center? Outpatient center. So you got in a car or a bus and went somewhere.
Or you went upstairs.
No, so different. It is, but yeah. So you physically traveled one way or another to the clinic, okay, and then used the same outpatient setting here upstairs, okay. How many of you have had someone come to your apartment for home care? Okay, you also can get it here, and I'll get to that too. How many of you have had it in a hospital? Yeah, usually you get it in the hospital if you're there for more than a day. How about a rehab? Okay. So part of rehab stays, short-term or long-term, you do get a certain number of rehab hours a day. So these are all just the different settings that physical therapy and also occupational therapy are serviced and provided. So you can have your outpatient setting, which is either upstairs with Benchmark or out in the community somewhere where you're physically traveling there. Those are typically for not non-urgent medical conditions or chronic medical conditions, joint pain, things like that. Whereas if you were to get home care, it is maybe a little bit more emergent, or it's difficult for you to get from your apartment upstairs. Maybe you just got home from the hospital, because the difference between, say, home care and outpatient, so if we're using names here, Beata and Benchmark, we work very well together. The difference between the two of us is we provide skilled home care. They provide outpatient therapy. So we bill your Part A benefit with Medicare. They bill your Part B benefit with Medicare. So typically how we like to see it work in a perfect world, and I'll be using this perfect world scenario a lot. Perfect world is you use Part A first because it is a free benefit. You don't have a copay. You don't have any out-of-pocket cost. You use home care first. We come to you, and then you go to Part B for your Part B benefit for outpatient. And then you can also think about a personal trainer as a supplement. That will be an out-of-pocket cost. That is not something that Medicare typically covers. Sometimes if your Medicare covers silver sneakers, you can think of it that way as a personal trainer, but that's usually like a group fitness class. And those are usually in gyms. Do they offer silver sneakers here at all? No. Okay.
But people do use them on Zoom.
Online. Okay, perfect. You can use that resource. I think Silver Sneakers is at the LA Fitness across the way. I'm pretty sure. And at the Roxborough Y. Okay, so you have options.
What does secondary insurance pay?
Secondary insurance. So I'm talking Medicare Part A and then Part B. Supplementals usually is not, to my knowledge, anything related to fitness. Usually it's like a drug plan or DME or something like that. But that I'm not quite sure on. I'm only speaking on Part A and Part B.
What if you don't have A and B, but you have C?
Usually you have A and B. That's the
Well, that covers it, but it's paid through what's it called? Advantage.
Oh, okay, yeah. So like everyone has Part A. Not everyone has Part B. That is for your traditional Medicare plan. When we get into like Humana and Keystone, Independence Blue Cross, these are managed plans, and those are a little different. Those typically don't have a Part B option. You will probably pay a copay. So if you're going to Benchmark or NovaCare or Ivy Rehab, all of these outside therapy providers, and they're saying that you have a $20 copay or more, it's typically because of your insurance. So that's why from a healthcare worker perspective, having traditional Medicare is going to be more expensive, but you get more bang for your buck when it comes to the services that are provided to you. And that's just my 2 cents. And that's just the changes that I've seen in healthcare over the past few years. It's definitely a trend of the managed plans are getting cheaper for the insuree. But if you look at the fine print of what you're getting, you're paying more for other options that are typically included or bundled under traditional Medicare. Does that make sense? But anyway, these are all the different areas that you can see a physical therapist and occupational therapist together. Physical therapists, we work for treating chronic medical conditions, acute medical conditions. We're licensed professionals, and we are all at a doctorate level. If we got our license after, I think, 1990 something, they switched to a doctorate level. So you may see us have the title as a master of physical therapy or a doctor of physical therapy. But we all are licensed according to a accreditation board. So we all have to take a board exam. Once we finish our PT school, we have to learn about every chronic disease and acute disorder in the book, how to treat it, what we can do, and also what we can't do, knowing our limitations. But our main goal is to improve movement, strength, balance, and pain. We focus on walking, stairs, posture, and recovery after an injury or surgery. So that last part is usually when people see us in this setting, is they went to the hospital or they fell. So these are all indications for physical therapy. Any questions on physical therapy before I get to occupational therapy?
I've got this.
She's armed. Occupational therapy. So they are the physical therapist's best friends. They focus on activities of daily living, ADLs. So this is you getting dressed in the morning, bathing, cooking, home safety. So all things for you to do things in your apartment safely. Okay. That's for the home care piece. They assess your apartment. If you are to see them in an outpatient setting, it might be that you have issues with fine motor tasks of your hands, or depending on the outpatient clinic. Sometimes they split it up with OTs take the arms, and then PTs take everything else. So if you think about it that way, OTs look at fine motor tasks, dressing, bathing, cooking, cleaning. Cleaning is not really part of it, but all things that you need your arms for. Yes, you need your legs to pull your pants up, but you're using your arms mostly to do that. If you're having trouble reaching down and putting socks on or shoes on, they can recommend modification devices, such as like a shoehorn or like a sock device. Yes, that is what I'm talking about. I don't know the name of it because again, I'm not an OT, but yes, that. And then also they will be the ones that maybe observe you take a shower if you're comfortable with that, or observe you go to the bathroom. Usually we see that in home care and hospital setting because hospital setting, they want to make sure you can do these things before you go home. And in home care, we want to make sure you're doing them safely in your home setup. Do we need to recommend a grab bar, an extra grab bar by your toilet or in your shower? All these things the OTs really focus on. OTs are also licensed professionals in the same way that PTs are. The only difference is they just started to get their doctorate degrees over the past few years. So most of them are master's level, but you will find some newer grads that are doctorate of occupational therapy. And their main goal is also the same as ours. We really want to improve safety and independence. You take one thing away from PT and OT, it's that. Okay. Any questions on OTs? All right. And now I know there was a lot of questions on this too. What is a personal trainer? So personal trainers are typically certified but not licensed individuals. There is, to my knowledge, no licensure for personal training, and it is mostly a certification that they can get. They are, don't get me wrong, they are very knowledgeable. They are very smart. They know what they're doing. It is just that's where the line is drawn on maybe reimbursement from insurance, payment models, and liability. Okay, they do not treat medical conditions. You cannot go to a personal trainer and say, I have COPD, help me. But you can go to a personal trainer and say, I want to get stronger, help me. So that is one difference, whereas you could come to us and we could throw the book at you and say, this is what we're going to work on, this is how it's going to help you. Where it works well, and I might be getting ahead of myself here, but where it works well with PT, OT, and personal training is personal training can really supplement PT and OT. So with us relying on insurance to pay for the services so that you're not paying an out-of-pocket cost, we're a little limited to what we can and can't do because we're dictated by insurance. So a lot of times that comes out with frequency. So we can only see you maybe once, twice, 3 times a week, depending on what's going on. Whereas sometimes we recommend seeing a personal trainer to make up that difference if we see that you could benefit from that additional work. Or if your body can tolerate it. Sometimes that's a little bit too much for everyone, right out the gate. Maybe it's, let's get through your episodes of PT and OT, and then for the next 6 months, work with a personal trainer without us, and then call us if you need us. Sometimes that works well. But personal training, they improve strength, balance, with a common goal of improving independence. So they also work towards that independence piece as well. Any questions on personal training? No? Okay. So going back to insurance, what happens when you want physical therapy or occupational therapy, or even personal training? We can get to that too. You identify a need because you all are independent. So you can make those decisions that you want to improve something about yourself. What do you do when you identify that about yourself? For physical therapy, no matter which setting, we need a referral, unless you want to pay out of pocket, which I do not recommend. we need a referral. So you go to your doctor, and typically they see you for a visit and they write a prescription for physical therapy or occupational therapy. That script then gets sent to whichever agency you would like to use for physical therapy or occupational therapy and then we run your insurance, and your insurance says this is how many visits they're allowed to get. Have at it. Okay, so that's our green light. That's when we are able to schedule and see you. And you're depending on what your diagnosis is, it will dictate your plan of care, as we call it, and what we work on. So, say you have Parkinson's disease. Say you have Parkinson's disease. We would work on your strengthening, your balance, and also big movements, loud movements. I don't know if anyone in here has Parkinson's disease, but this is one where it's really beneficial to work with a personal trainer on the side as that supplement, so that you really focus on maintaining the progress that you made up to that point and improving onto that progress after the fact. So that Parkinson's disease is a really great scenario to use a supplemental personal training piece. We also prescribe home exercise programs if maybe it's a little too difficult or a little not enough finances to pay for a personal trainer. We provide home exercise programs as well. Home exercise programs. Yep. So it's usually a handout, and we walk you through it. This is what we want you to work on between now and your next visit. So we do that a lot as well. Another scenario is after surgery. So say you had a knee replacement or you fell and fractured your hip. Definitely something that you want to keep the progress going. So home exercise program and or personal training on the side. But if you have something like COPD or heart failure, I personally, depending on how you present, I probably wouldn't recommend additional supplemental training, because we want to make sure your body is tolerating the exercise that we're giving you to. So every session we're assessing, no matter what the diagnosis is, we're assessing how you tolerated the last session. A lot of times, if it's your first session in a while or your first session ever, you might complain of a lot of pain or soreness. A lot of times we get called names, pain and torture instead of PT. There's that, but that's normal is how we have to word it. It's normal for your body to adjust. And a lot of times we're having difficult conversations where people are pushing themselves too far or too hard. I want PT every day. Okay, I wish you could have it every day, but sometimes that's not the most appropriate right now. And especially in the home care setting, we're kind of that gap of that gap between being able to run a marathon and just coming out of the hospital. So it's person dependent, patient dependent, and that's why we focus so much on our evaluations and our reassessments, because we listen to you, we adjust what your needs are to make sure that you're getting the most out of this benefit. Okay. PT and OT, you should not see any out-of-pocket costs, again, depending on which insurance you're using. If you do, you might see the out-of-pocket cost with Part B, but you should not see it with Part A. And then personal trainings, like I said, they don't bill through insurance, so they don't need a referral. So you could just call or walk into a gym and say, hey, I need personal training. But again, using my guidance there, if you have a lot of chronic medical conditions, if you're on oxygen, or you just got out of the hospital, maybe don't walk into a gym and say you need personal training. Call your doctor first. But they don't need a referral, so they can see you as much as you're willing to pay, essentially. Okay. and this is kind of what I've been saying the whole time, can you work with a PT and a trainer, or a PT, OT, and a trainer? Yes. We work very well together. We complement each other in the case of continuing progress along, filling in the gaps with insurance. And you can see personal training in the form of one-on-one, fitness center, or group fitness classes.
Will personal trainers communicate with a physical therapist or an OT?
Mm-hmm. Yeah. So we have that ability. Just let us know. Yeah. We don't know what we don't know, but again, we probably should know based on our assessments and everything. But yes, we can communicate with each other and make sure that we're overlapping at an appropriate level to make sure that everything's flowing smoothly. Okay. All right. So this is kind of what a typical. Why does this keep moving? This is what a typical home exercise program looks like. So we give you maybe 2 to 3, 4 max exercises to work on between sessions. And those exercises have a specific goal to improve what we're working on. Okay, so this one would be a typical one that I would give. A sit to stand would work on strengthening. So this would be some overall body strengthening, specifically legs, but also upper body. Tandem stance would work on balance. Tandem stance looks a little like this, one foot in front of the other. Okay. And then single leg stance, I'm jumping. Single leg stance is again balance, and that is one leg. Okay. So that one is, depending on how easy or hard it is for you to do the balance exercises, that's one I would recommend. And then a farmer's walk is less involved than it sounds, but you basically just take 2 moderately heavy items, 2 milk jugs, say, and walk a distance with them. So you walk, pretend that I'm not holding a microphone, but I have 2 milk jugs in my arms, and I'm walking just normally.
One side at a time or both?
Both sides. Yep, so like this. So you want 2 moderately heavy items in your hands. Milk jugs work fine, weights if you have them. And I would say about 15 feet and do a couple laps of those to your tolerance. And again, I'm not giving these exercises willy-nilly to someone that I don't know right off the street. I know that they can tolerate whatever the frequency is, but this is just an idea of what it would look like.
Question about the farmer's walk.
Mm-hmm.
I had been advised to do that, but hold them up, not down.
That's fine. Up would get more upper body strength.
Correct.
Down is just your standard height.
Correct.
Yeah.
So you're getting more holding them up.
Yep. And again, if I'm working with you, I would make that recommendation if you had some upper body strength goals. I think you have a question. Oh, another one.
So when you do things like the tandem stance or tandem walk, should you do those with shoes or barefoot?
It depends. I would recommend with shoes to start and holding on to something. So balance exercises like these I usually recommend when you're brushing your teeth or when you're standing at the sink. So you have something in front of you. And then you can progress it to with or without shoes. I typically recommend shoes just because it feels safer. And then from there we can work on, maybe we put you on a foam pad in your PT sessions. And then at home, what does that look like? Maybe you're standing on a towel. So there's all things that we can kind of modify and make things more difficult or easier. Any questions? Has anyone had a home exercise program like this that I'm describing? Usually they have pictures, so it's a little user-friendly. Sometimes there's videos. And then also, while I was putting this lecture together, the CDC website and the Silver Sneakers website specifically have a lot of resources. So I know you mentioned that some of you already use the Silver Sneakers Zooms. There's a lot of resources. I debated printing them for you, but the handouts were like 20 pages long for each. So I think I would have sacrificed a lot of trees if I did that. So I'm recommending that you check out their websites, and you can also see videos that way too, because this is also where I'm crossing the line. I don't know how much you all exercise. I don't know what levels you're at, so I can't recommend anything ethically because I don't want you to get hurt. So if you're watching the videos, you're able to see the form and you can modify and listen to what they're saying. Or you can see a physical therapist, work with a physical therapist, an occupational therapist, or a trainer. So you have a professional working with you so that you don't get hurt. Okay. Do you guys have a gym here that you can use just on your own? Okay. How many of you use it? It's not a gym? It's a fitness center. Okay. So it has machines and weights and things like that? Okay. And did any of you ever get a one-on-one session on how to work? Okay, good. Okay, that's good. You don't always see that, and that makes me very nervous, especially when I see treadmills. Oh, good. Okay. And you guys do group fitness classes?
Yeah.
Good.
Many classes.
Good. Okay. So you guys might be more fit than I am at this point in my pregnancy. What'd you say?
Aquaside
Oh, you have a pool.
Yes.
Oh,
and wax.
okay. Okay, cool. Okay. Where is your pool? Is it on the roof?
It's outside.
Right around here somewhere.
Okay, I did not know that. That's pretty cool.
Right down the hall.
All right. So going into that, tips for exercising at home. So if you are to do an online program or go to the fitness center, working out with a friend, want to make sure you warm up. So warm up your body. How that looks is you can jump on the, well, not jump, but get on the bike for 5-10 minutes. Treadmill, if you can safely get on and off the treadmill by yourself. Those are great ways to just warm up the muscles. You never want to work out a cold muscle. Making sure that you have the support if you need it. So if you are working on balance exercises, making sure that there's maybe a bar or a chair, something sturdy for you to hold on to for support. If you start to feel dizzy or short of breath or having chest pain, making sure that you're notifying someone as soon as possible. Dizziness can be something as simple as you stood up too fast. Solution to that in the immediate situation, sit back down. But chest pain, shortness of breath, making sure that you're notifying someone because that could be something more serious. Asking for a demo if you've never worked with a machine before. That's a great way to get injured if you were to guess how a machine works, because they need to be sized appropriately at the right spot for each heights and leg length and things like that. So making sure you know how to change the settings on the equipment to safely use them. Online videos work well, and have an exercise partner. It's not really fun to work out by yourself. Having someone else is a socialization piece, makes it more engaging and fun. You can talk about your weekend and your grandkids. So just having that extra support will make sure that you stay up to date and motivated with the exercises.
Is that George and Barbara?
It could be. Sure. Question?
Do you recommend Tai Chi and yoga?
Yes.
We have instructors for both of those.
Perfect. I would say try out a class. Tai Chi and yoga they're different, right? Has anyone ever done them? Okay. Specifically Tai Chi. Okay. Different, right? It's a different type of exercise. It's focused more on like slow body movements. So try it out if you haven't tried it. Yoga, I love yoga. I think that is very helpful, especially as you get older. Keeps your joints mobile, and it helps with your balance. Tai Chi also helps with your balance as well. So yes, I recommend them. Might as well keep it.
But neither the Tai Chi nor the yoga help me open up the bowels. I can't open them
Yes,
up.
so that would be the difference between what I was talking about with, say, PT and OT. That would be a fine motor task. So a group fitness class or even personal training probably won't help you with that either. That would be where you want to see an OT.
I can give it to somebody else to open.
Or you could do that. You could do that as well. Anyone else? Okay. And then lastly, here we have long-term benefits of just really exercise in general. As your bodies are getting older, you're getting weaker. So we want to make sure that we're focusing on strengthening and balance training. Because the last thing that we want to happen is a fall. How many of you have had a fall? How many of you have had a fall and didn't raise your hand? Falls can be anything from a bump and a bruise or a stumble to something more serious, fractures, hospital stay, rehab stay. So they're likely going to happen at some point in your future or have already happened. Our goal is to prevent them as best we can, or if they do happen, what do you do next, right? So research shows if you have better reaction time, you can protect yourself from falling. So what does that reaction time look like? It looks like balance and it looks like strength, improving both of those. If you are walking where there's nothing for you to hold on to and you have the best reaction time in the world, you probably will still fall, depending on what it was. You tripped over a cat or a cord. But we can limit that from happening by working on prolonging the normal decline in these functions as we get older. Greater independence. If you are able to open bottle caps and jars by yourself, that would say that you're pretty independent, right? So we want to make sure that you can do these things without asking for help. Getting in and out of the shower safely without asking for help. Even if you're still driving, getting in and out of your car, that's something that you need independence for, because I don't know, I feel like I lost a little bit of independence this is my second child, when I lost my first child, so I can feel a little bit of your pain as you get older when you're losing your independence. So how can we continue to keep that independence strong? So I can speak for rehab and exercise and physical therapy, that's how we do it in that perspective. But I know independence is a very broad term, so we're just able to help with a little piece of it. Management of chronic conditions and diseases, that is also a long-term benefit. And then improved confidence and quality of life. Another big piece of a fall's risk is confidence. If you don't feel confident in the way that you're moving around, you are 10 times more likely to fall because you're guarding yourself and you're moving slower. We don't want that to happen. We want you to move safely, but the more guarded and the slower you walk, the more likely you are to fall. Okay? And quality of life. These are your golden years, right? You want to make sure that they're enjoyable. You don't want to be in pain all the time, and you don't want to be locked in your apartment. So you want to make sure that you're able to socialize, you're able to get around safely. And I'm sure for those who do use the fitness center or the group fitness classes, it's fun. It's engaging. Okay. All right, now we're going to get to the Q&A. We kind of dipped into it a little bit, but feel free to fire away any of your questions. I'm happy to answer them. And none of you fell asleep either.
How do you distinguish between, okay, this is just kind of normal aches and pains, and yeah, I really need to see somebody?
That's a good question. So it would really be how long have you had those normal aches and pains. If you've had them forever and nothing helps with them, you might as well look into PT and OT. And there's going to be a common theme here with my answers. it won't hurt you to look into PT and OT. It's a free benefit for you. If anything, I want you to look into it. So even if you do have chronic aches and pains, and you do know what helps, taking Advil, but maybe it's taking 5 Advils, that would help you make your decision to call your doctor. Sometimes your doctor's recommending it. Sometimes they're saying, oh, you still have this neck pain and nothing's helping. Why don't we try this? Does that answer your question?
What exactly is syncope?
You wanna just repeat it?
The question is, what is syncope? So syncope is passing out, fainting. That is where you lose consciousness for a second or longer.
I do that regularly.
Do they know why?
I've always done it.
Well, that's concerning.
I mean, it's not something that's developed recently.
Yeah.
If I take the COVID shot, I'll pass out.
Okay. Is it always around like needles and
No.
no? I would ask your doctor about it because syncope is not something to kind of just brush off. No one likes to be unconscious for any second or any minute. But the concern is if you're doing something like driving. I don't know if you still drive.
No.
If you are,
No, sitting on the side of the bed
I would
and I wake up on the floor.
call your doctor.
Oh, I do.
Yeah,
Yeah.
and they don't do anything.
They send me to the hospital and they say, they do things and then they say syncope.
Use the mic, use the mic.
They say syncope.
Yeah, so it sounds to me like something more serious could be going on if you're just sitting in bed and you're passing out. It could be cardiac. Yeah,
Blood pressure.
blood pressure, it could be blood pressure. I would strongly urge you to make an appointment with your doctor and really try to get to the bottom line of it. That is not something, and again, I talked about knowing what we can do and what we can't do. I can't help with syncope, but I can direct you to the right spot. Because I struggle with it. They had to put me on a beta blocker for this pregnancy because I was passing out, and I wanted to make sure that I got seen and I got checked out because I was terrified that I'd be doing something, holding my firstborn or driving. And it was the same thing. I was just sitting, not doing anything, and I would just feel dizzy. So make sure you call your doctor.
So in defense of doctors, since I are one, I was an emergency physician.
Okay.
I'll tell you, syncope is one of the most dreaded diagnoses in the emergency department because there's so many things that are benign and very life-threatening. And it's really hard to differentiate them, especially when it's recurrent. And I'm
Yeah.
sure that they've done all the appropriate workup.
I'm
and
sure,
it's,
yeah.
It's very frustrating that you're not, and I'm sorry that we aren't helping you on that.
Yeah.
I also wanted to throw in my regard for physical therapists and OTs is incredible. I think you guys do wonderful work.
Thank you.
And have done a lot of work on me. I have a question that may not relate to everybody else. Is there access here to speech therapy?
Yes. Yeah. And I intentionally left speech therapy out of my
Okay.
presentation
I'll let you know.
because I felt like I would get into a tangent with the personal training piece. So I know the question for this lecture was the difference between the two and how we can work together. But yes, consider everything I said about OT and PT, speech therapy as well. They're professional degrees, licensed professionals, and they can bill insurance. So bundle them into PT and OT, not speech
But
or
is that
personal training.
accessible here?
Yeah. So you can for any agency that you receive PT and OT, they also have speech therapy. Yeah. So whether it's home care or upstairs, they have that as well. And speech therapy in general, they will work on speech quality, swallowing, and also some cognitive exercises as well.
I have two questions. One is, the people who are in our physical therapy department, are they all qualified physical therapists, or are some of them
So
interns or?
upstairs?
Yeah.
Yeah. So I don't work for them, so I can't speak for what their roles are. But if they have, I would look at their badges. So if they have physical therapist on their badge, they are a physical therapist. You might also see a PTA or a physical therapy assistant. They are also licensed professionals. They just work under a physical therapist in the same way a physician assistant works under a doctor. You might see the same thing for OT, speech. Speech doesn't have assistants, but OT has assistants as well. But you might see techs. So if there's a tech or an aide, they are not licensed professionals. Think of them like a nurse aide. Yeah. So I, with me not knowing the ins and outs of the rehab department upstairs, I would just look at their badges.
Okay, the other question is resources for exercise when you have osteoporosis.
Mhm.
I go to a lot of the classes here, but they ask me to do things
You can't do.
that I shouldn't do.
Yeah. And that's the frustrating piece too, is the modification, where you get the modification on the one-on-one sessions, but group classes, not
I
necessarily.
hate to bother everybody else, but
Yeah. But you have to listen to your body. But those websites that I talked about, CDC and Silver Sneakers, I remember seeing they did have some osteoporosis, osteoarthritis specific exercise programs.
thank you.
I just wanted to speak to what you just said. I do water workout here 3 times a week.
Yep.
The answer for that in any class she gives is if it hurts, don't do it.
Yes. Yes, that is smart advice. If it hurts, don't do it. But also you brought up water exercises. They really help with osteoporosis as well. You would be surprised.
I've been told, no, that they're, never mind, it's that personal. Wait.
I'll just throw in a frustration I had with our people upstairs. I have so far still undiagnosed pain of all kinds of things. When I went on pregnancy, I got rid of a lot of it, but it scares me.
Sure.
It's a dangerous drug. Anyhow, I was starting out with PT a couple times a week, and I said, but my shoulder hurts. I can't help you with that. That's OT. So it seems like upstairs you mentioned this, bottom half of your body is one department, upper part of your body is the rest. And when I asked the physical therapist, she said, well, we don't have time to do both. That frustrates
Yeah.
now that I've taken the prednisone for a while and I'm on fit finally.
Yeah.
I found out my problem is my upper body. So I'm not doing any of them. I need MRIs and stuff. It's just frustrating when you say, can you help me? And they say it's not my department.
Sure. Yeah. Do they have someone with an OT there? And were they working
And
with?
I went to OT also.
Yeah.
And I stopped because nothing stopped pain until I got on prednisone.
Okay. Well, and also sometimes that's the case. As with everything else, you need to know your limitations. So we can give it a try, work our best with the chronic condition, what is going on. But yes, at times, and that's as frustrating as it is for you, it's equally as frustrating for us. It keeps me up at night when I can't help someone. So I understand that there are times where we don't help. I hate to see that happen, and I hate to see that scenario that you just described. That someone said it's not my job. But again, it's frustrating when you're in pain and you're trying to find the answer. I hear you on that piece. I think Rudy.
Okay, I'd like for you to talk a little bit more about BIATA
Sure.
and the interface with the other parts of healthcare here.
Happy to.
I'm one of the people who's been here over a year.
Mhm.
I know virtually nothing about it. I've never gone there. I've had PT broken bones and dumb
Sure.
things like bicycle accidents and so forth. But
Dumb things. Yes, so kind of alluded to that too. We're two different companies, but we work together. Beata and Benchmark. So that's why I don't know who's in their department. I don't know who's telling you those things. But we do the home care, the skilled home care. So our role is to come to your apartment. We don't take you to their gym. We don't really take you anywhere unless we're seeing how you walk to the cafeteria, dining room. Our role is to work on things with you in your home. And then once you're finished with us, we refer over to Benchmark for additional therapy. Also with Beata, you get nursing services if you need nursing services. That's the main difference between home care and outpatient. Home care is more skilled, higher needs, so that you can get that nursing piece. Say you just got home from the hospital, you have stitches or a wound, new oxygen. That's where you would get a home health nurse. Think of like a visiting nurse, right? I'm sure we've all heard that term. And then you also can get physical therapy and occupational therapy as well. You don't need to have nursing to get home care. You can have home care with just therapy. Trying to think what else.
You also provide hospice care.
We also provide hospice care. Yep. Yep. I don't want to steer away from Rudy's initial question. But Beata, essentially, we bill under the Part A benefit, like I talked about, and then we refer over to Part.
Oh, you can't sit there.
I forgot. Yep.
You okay?
No, because of this.
Oh, okay. It sounded worse than it was. Just tape. Okay.
You need tape therapy.
Yeah. But yeah, does that answer your question? Kind of the two difference. I also have pamphlets here, specifically talking about Beata services and who to call if you do want to pursue our services. But we essentially do the home care, and we come to your apartment, and then we refer elsewhere after we're finished. I want to let Rudy
Yeah,
finish.
So I fall off my bicycle again.
Yeah.
I fall off my bicycle
Uh-huh.
again and break another bone. Does that mean, and I have a prescription for PT,
Mhm.
does that mean I go to Benchmark, or do I know they'll take my insurance?
You could do either. I would say if you were my relative, I would say use your Part A benefit first because it's free. And a lot of hearing all these questions, it sounds like this is not a known thing here. It's a free benefit. The same script works for us as it works for them. You will get the same services to your apartment, and then you can transfer to your Part B benefit after you finish with your Part A benefit. Your Part A benefit, depending on your insurance, can last anywhere from 30, 60 plus days, depending what's going on. If you fell and fractured your arm, and you have abrasions on your arm, I would say use home health first. And then once you finish your goals with home health, go on, to Benchmark. So kind of like a step piece.
Under the managed care, I don't have the choice of A and B. The last time I had physical therapy, it was a Rothman. I didn't pick it.
Managed plans always have Part A.
Okay.
Yep. They always have Part A. They just don't always have Part B.
Got it.
So my guess is you probably have a copay when you go to outpatient, yeah.
So things might have changed, but when I had home PT after my knee operation,
Mhm.
PT couldn't start until the nurse came in because they had to
Things
have
changed, yeah.
orders under the nurse.
Yep, things changed. It used to be that you always had to have nursing, and then we kind of looked at it and said, or not us, but Medicare looked at it and said, no, that's not always the scenario. But if nursing is ordered, it still stands. If nursing's on the order, which typically if after a surgery it is, that nurse has to open the case unless the doctor specifically okays PT to go in first. But it used to be always, no matter what, nursing was always attached. But then we started to realize not every case is a nursing case, and we were overutilizing services.
Looks like we covered it.
Okay. Finished? Yeah?
Thank
Okay.
you.
Awesome. Thank you. I'll hand out these pamphlets for everyone who's interested.